Infertility and Today's Technology, Biology 1310, Group Members Adora and Tiffany.
Slide 2, an overview defining infertility in women and men, type of technology we have today that helps with infertility, and how does infertility affect a woman versus a man. These are the themes that will be debated in the PowerPoint. To start, I will be defining infertility. As I was defining infertility, and there's infertility in women and men differently. Infertility means the inability to conceive a child naturally after trying for a year, for women under the age of 35. And when a woman is over the age of 30 or 35, 6 months will be the maximum time to have been trying to have a kid, and that will be considered diagnosed infertile. When it comes to men and infertility, there is a difference because for men to naturally produce fertile sperm to have children and is unable to do so is considered infertile. And men experience infertility against a backdrop of changing understanding of his role as a man in society and medical possibilities. And multiple of causes can create that: illness, injuries, etc. When it comes to technology, modern technology with assisted modern reproductive technology, art, it is very advanced nowadays. And this all include the measures that involve the manipulations of gamete and embryos outside of the human body to help them conceive and procreate life. So, and this
In vitro fertilization, IVF, is the most common assisted reproductive technology technique. It involves stimulating and retrieving multiple mature eggs, fertilizing them with sperm in addition to lab, and implementing the embryos in the uterus several days after fertilization. Other techniques used in the IVF: intracytoplasmatic sperm injection, ICSI. A single healthy sperm is injected directly into the mature egg. Assisted hatching. This technique assists the implantation of the embryo into the lining of the uterus by opening the outer covering of the embryo. Donor eggs or sperm. Most assisted reproductive technology is done using a couple's own eggs and sperm. However, if there are several problems or severe problems with either the eggs or the sperm, you may choose to have eggs, sperm, or embryos from a known or anonymous donor. Gestational carrier. Women who don't have a functional uterus or for whom pregnancy poses a serious health risk might choose IVF using a gestational carrier. In this case, the couple's embryo is placed in the uterus of the carrier for pregnancy. Intrauterine insemination. It's also called donor insemination, alternative insemination, or artificial insemination. IUI works by putting sperm cells directly into your uterus around the time you're ovulating, helping the sperm get closer to your egg. This cuts down the time and distance the sperm has to travel, making it easier to fertilize the egg. The sperm is prepared for insemination through a process called sperm washing that pulls out a concentrated amount of healthy sperm. During the procedure, they use a small syringe to insert the sperm through the tube directly into your uterus. The cost of IUI varies depending on the type of insurance coverage you have. In general, it costs about $300 to $1,000 without insurance. Guymet intrafallopian transfer, GIFT, and zygote intrafallopian transfer, ZIFT, are modified versions of in vitro fertilization. In ZIFT, the fertilized eggs at the stage called zygotes are placed in the fallopian tubes within 24 hours. In GIFT, the sperm and eggs are just mixed together before being inserted, and with luck, one of the eggs will become fertilized inside the fallopian tubes. In ZIFT, the eggs are placed in the fallopian tubes rather than directly in the uterus. With GIFT, fertilization actually takes place in the body rather than in a petri dish. Since GIFT and ZIFT both require surgical procedure that IVF does not, in vitro fertilization is almost always preferred in choice in most clinics. In vitro fertilization accounts for at least 98% of all assisted reproductive technology procedures performed in the U.S., while GIFT and ZIFT make up less than 2%. Multiple pregnancy. The most common complication of infertility treatment is multiple pregnancy, twins, triplets, or more. Generally, the greater number of fetuses, the higher the risk of premature labor and delivery, as well as problems during pregnancy such as gestational diabetes. Babies born prematurely are at risk of health and developmental problems. Ovarian hyperstimulation syndrome, OHSS. Fertility medications to induce ovulation can cause OHSS, particularly with assisted reproductive technology, in which the ovary becomes swollen and painful. Symptoms may include mild abdominal pain, bloating, and nausea that last about a week or longer if you become pregnant. Rarely a more serious form causes rapid weight gain and shortness of breath, requiring emergency treatment. Bleeding or infection. As with any invasive procedure, there is a rare risk of bleeding or infection with assisted reproductive technology or reproductive surgery. The Centers for Disease Control groups together all procedures that constitute assisted reproductive technology, including in vitro fertilization, GIFT, and ZIFT. The most recent report, based on data from 2015 and published in 2017, was as follows: 29.3% of all cycles that used women's own eggs or embryos led to successful pregnancies. Single fetus pregnancies accounted for about 70% of pregnancies. Multiple fetus pregnancies accounted for 23% of pregnancies, while the number of fetuses could not be determined in 7% of pregnancies. About 70% of the cycles carried out did not result in a pregnancy. Less than 1% of all cycles resulted in an ectopic pregnancy, where the embryo implants outside of the uterus. About 82% of pregnancies resulted in a live birth. 18% of pregnancies resulted in miscarriage, induced abortion, or stillbirth.